So in this session, we will look at health systems development. Uh, that time when the WHO put forward this, the goals that were set for 2015 was the Millennium Development Goals, and then they looked at how does the health systems contribute to the achievement of these Millennium Development Goals. So on one side, we have the stakeholders' expectations. They wanted accountability, better results, higher quality, greater efficiency, greatest number of people served, equity and affordability. All these were the people they were expecting. So the health services has to be organized to address these issues, and they had to be organized in the context and the dynamics of various parameters. Things like health reforms. Time to time, we discussed in the previous lecture, we need to reform, change uh, due to various changes in the society, economic changes, new development, demographic changes, then with the disease pattern changing, new technology coming like that. So therefore, we need to make reforms based on the requirements. And then the need for decentralization. Again, we discussed about the 13th Amendment and the decentralization of health services. And then we also discussed about the increasing costs. Annually, the health budget is going up and up. And also, compared to the needs and this thing, the resources are decreasing. And the demands, changing demands, the people, what they wanted down there are asking for more. And then the problem of poverty, and then technical innovation, and so many multiple initiatives. So therefore, considering on these two sides, the stakeholder expectation and the context and the dynamics, we need to look at the health systems, health services organizations. So the WHO put forward a framework for improving organizational performance, a framework for improving the organizational performance. It's derives from the model that we learned in the morning, the management model. So if you look at this, there are some similarities with this and that. So what we are discussing in the health systems, when you talk of health system, the policies, the financing, the technologies, the people and the infrastructure comes to our mind. Those are the parameters. And then we talked about these are delivered within the culture for the people, within the environment, and the culture in of that environment. And it is very important about the leadership, the human resources, what we are expecting, the needs, goals, and strategies, structures, and the partnership resources. And with those, we need to carry out with these processes in the middle, that is the service delivery operations. And what we delivered, the outputs and the outcomes are given on the other side. The outputs and outcomes includes organizational. We expect the health systems to improve the quality, efficiency, effective coverage to improve. Then the responsiveness, which we discuss, the non-medical aspects of care to the community, and all will lead to the better health outcomes. That is the need that we were looking at, right? So and it is all based on the this looking at the health outcomes. To get that, we need to look at how well we have to look at the innovations, new ways of doing things in the health system, new knowledge and information. So the WHO put forward six building blocks of a health system. Six building blocks. What are those six building blocks? Firstly, the services. Good health services are those which deliver effective, safe, quality, personal and non-personal health interventions to those that need them when and where needed with minimum waste of resources. So the services, that is the process part of it, we have to deliver it efficiently to achieve our objectives and outcomes. So the process part of it, that is delivering the services. Then in that we identified the well-performing health workforce is one that works in ways that are responsive, fair, and efficient to achieve the best health outcomes possible, given available resources and circumstances. Uh, that is, we should have sufficient staff, fairly distributed, they are competent, responsive, and productive. So that is important. One of the main important inputs is the health workforce, trained, motivated health workforce. And then we need, it cut across all these blocks is the well-functioning health information system. Is one that ensures the production, analysis, dissemination, and use of reliable and timely information on health determinants, health system performance, and health status. So at each stage we need information to measure the efficiency, effectiveness. We need information. So therefore, that is also part of the system. One of the most important blocks in the building, health system building, health information. That is the third block. Fourth is the medical products, vaccines, and technologies. A well-functioning health system ensures equitable access to essential medical products, vaccines, and technologies of assured quality, safety, efficacy, and cost-effectiveness, and they are scientifically sound and cost-effective use. So that is the fourth block. And the fifth building block is a good health financing system. Raises adequate funds for health in ways that ensure people can use needed services and are protected from financial catastrophe or impoverishment associated with having to pay for them. It provides incentives for providers and users to be efficient. So a good financing system. That's why people look at the Sri Lankan system, and many people, economists said, I can remember on some time back who came here, you have a very good financing system. Don't tamper with that system. People are now trying to this thing. This is everybody is contributing. That is a tax-based system, and the services are provided free. All these issues are the people don't go into poverty because of that, because the services are free. So the good health financing system, and some people suggest that the costs are going up, therefore we need to introduce a health insurance system and so forth. But you can see the problems of administering an insurance system and the cost of running that in the situation. So this is without much administrative work, we are financing the system. Then the last building block is important, the leadership and governance. Involves ensuring strategic policy frameworks exist and are combined with effective oversight, coalition building, regulation, attention to system design, and accountability. So leadership and governance, some call the stewardship, the leadership given to run this thing. So that is also important building block. So those are the 6 building blocks. The WHO where the health system relies on is put on that. Health services, health workforce, health information, medicinal products, vaccines and technologies, health financing, leadership and governance. So if you are asked to discuss a health system, you could use these building blocks because that contributes to the good system to run it. So you can discuss based on that. Some of you discuss when you present in the country. You took those up, how it is governed, how it is regulated, how from where does the money comes in. So those are the issues that you have to. So remember these 6 building blocks in describing a health system. So these are according to priority, they have put down the building blocks. The service delivery comes first, health workforce, information, medical products, financing, leadership and governance. So the aspects of health, when you are going to develop a health system, these are the areas that you important aspects that you have to look at. One is the human resources. Secondly, the health infrastructure and facilities, health information, quality of health care, revisiting the primary health care. So these are the aspects. Human resources, you have to look into the gaps. We have problems. We have cadre existing. We have sometimes the cadres are old. We need to revise time to time the cadres. And then no point having a good cadres all approved if you can't fill the vacancies. So you have to production has to be important, and you have to fill those cadres for the health system to run. No point having a cadre of workers, but you have to have people in those positions. So then, thirdly, the very important aspect of human resources is the capacity building. You have to train them well. Then they, after training, basic training, they have to develop them in the system itself, continuing education programs and so forth and so on. And then also you have to look at the future needs also, and therefore you have to do what is called cadre projection. Okay, in the future, how much we will need, because you have to produce that amount of people, and the production will depend on the projection that you make forecast. So you have to look at what in the future, how much we will need, and finally, you have to look at the production and the supply of human resources. Production part of the now in our system, the production is part responsibility of the mostly the higher education, right? The delivery is part of their employment is with the Ministry of Health. So two ministries also involved. So the production they have to work uh, closely together with regard to ensure that the production and the supply matches. Then with regard to health infrastructure and facilities, you have to plan how many hospitals to be upgraded without irrationally upgrading just because of the sometimes the politician want just to the sake of upgrading. Yeah, there must be some rationale and need to upgrade the hospitals, and you have to plan it well. Then the location, distribution of hospitals, geographical and strategic location of the hospital. Then the drugs, ensuring a continuous supply of drugs, transport, especially the ambulance services has to be there. Then facilities for health staff, their accommodation, um, uh, and so forth has to be there. Then with regard to the information, we need basically three types of information. We need to have a separate health workforce database, information about the human resources. Then we need to have a disease surveillance system. For that, we need an information system of reporting the diseases and surveillance of those diseases. And then we need to have health statistics, that is to monitor the development of the health situation. So then with regard to the quality of care should be acceptable to the people, and it also all the people should be accessible to good quality care. And also we had to uh, pay special emphasis in marginalized or neglected populations. Some estate areas still need to be developed, so we have to identify those backward areas in areas after the conflict. So we had to make special attempt to address those issues in those special areas. Then it is important to look at our primary healthcare system, the role of the primary healthcare worker, the training of the health workers, role of the primary healthcare volunteers, intersectoral coordination, various sectors have to work together, and the importance of community getting involved in the care. So, a more effective role for WHO at the country level. WHO has set the existing standards and guidelines, and so putting all these the six building blocks together. This is again the six building blocks revolving around the leadership and governance. At the top, we have the service delivery, then the human resources, medicines and technologies, financing, information. So again, that model the WHO has applied the health system building blocks, the six building blocks: service delivery, workforce, information, medicinal product, vaccine technologies, financing, leadership. Those are the inputs, and then the process has to be. It has to cover the people, the coverage. It should be accessible to the people, and it should be of good quality and safety. And then, what are the outcomes on the other side? Uh, what we expect is improved health, responsiveness, better responsiveness, social and financial risk protection, and improved efficiency. These are the results that we expect. So this is the WHO health systems model that they have put forward, and they have identified from that model core functions. The WHO has identified what is their role. I think this in the next lecture we are discussing in detail the role of foreign agencies in healthcare. WHO have identified in the general program of work uh, the core functions, the basic functions of WHO. One is providing leadership, engaging in partnership where joint action is needed. So WHO is recognized the leading health care agency that gives the leadership for health development. Stimulating knowledge generation, translation, and dissemination. They share a lot of literature. Setting norms and standards. There are people refer to WHO guidelines when it comes to various things like food safety and so forth. Articulating ethical and evidence-based policy options. You have to be ethical, and also the policy when you are making policy decisions, those has to be based on evidence, with evidence. Uh, Providing technical support, catalyzing change, building sustainable institutional capacity. Uh, WHO is not considered as just a funding agency. It is not funding agency where it gives money, a lot of money. World Bank, those are the organizations which are mostly. WHO is considered a technical agency. More than money, they give technical know-how. So, providing technical support for catalyzing change, building sustainable institutional capacity. So, that is one of the core functions of WHO. They consider it as one of the main functions of WHO, technical as a technical organization. And then monitoring and assessment of trends. Over the years, they see what is happening to health in the world. So they have for that they have 13 strategic objectives to achieve those. So that is basically the WHO view about developing health systems